Good morning, everyone. Before we start, given some of the discussions around ambulances and things, I thought it would be worth letting you know what this isn't about. And this isn't about procurement of ambulance services. So this is a separate piece of legislation. After extensive consultations, the Department of Health will be advancing legislation in the House of Assembly today in less than half an hour to govern emergency health and paramedicine sector. It will provide the department with the authority to identify competencies necessary for paramedicine providers to be licensed to deliver care. In addition, this legislation gives the department responsibility for issuing licenses to ambulance operators. It gives the department the ability to establish standards for the management and provision of emergency and paramedicine services. A high-performance emergency service that consistently and predictably delivers clinical excellence, response time reliability, economic efficiency, and patient and customer satisfaction. The Auditor General in 2016 found ineffective oversight of the programme and a lack of operator accountability. Most recently, a review conducted by Grant Thornton found that 77% of operators over a 3-month period were not compliant in meeting their contractually obligated staffing requirements. This legislation clearly sets out operator responsibilities, giving them the force of law, while strengthening government and operator accountability. It does not change the landscape of the road ambulance programme, but rather legislates existing programmes and structures. It gives government the authority and oversight to monitor and enforce compliance. Some highlights and key components of the legislation are utilising existing practice. It will allow the Provincial Medical Director to establish protocols and guidelines to direct patient care by paramedicine providers. It will establish a clear mandate and enforceable authority. The legislation also charges the Director with the responsibility to develop a quality assurance programme and the authority to monitor compliance of clinical programmes. We're working with paramedics to develop a new process for self-regulation. Under the new legislation, the Public Utilities Board will no longer issue motor carrier certificates to ambulance operators under the Motor Carrier Act. The department will instead issue licenses to operate a service. In terms of emergency and routine transfers, the new legislation sets out conditions under which an operator license may be issued and the services they're authorised to provide. Furthermore, the legislation gives the department the authority to establish processes to issue, renew, suspend or cancel operator and paramedicine provider licenses. And finally, the new legislation allows for the continued modernisation of our ambulance programme while greatly improving transparency and accountability across the system.